Sebrin Jensen.
And I'm Danae Young, and we have Courtney Caldwell today with us, and she is going to go over low intervention birth methods, and we're in one of our labor suites. Can you show us some different positions that a woman might be able to do while she's pushing?
Sure. So this is probably one of the most common pushing positions that we use or that we see. These are foot pedals. We've got mom kind of in a semi-sitting position. In this position, a lot of ladies can actually kind of grab behind their thighs as well and pull their thighs back just a little bit. The partner can also kind of hold on to their foot and assist with pushing mom's feet and thighs to help support her. What I like about the foot pedals is it kind of leaves mom open to do what she wants and what feels comfortable to her. Another option is we have stirrups attached to the foot pedals that come up, and it actually supports mom's thigh here. So if mom feels like she wants a break or she wants a little extra support, that can be very comfortable to her. So this is probably the most common method that we use for pushing.
How do you feel in it?
Comfortable.
Yeah.
What's nice too is after she's done pushing, she can just kind of lay back and rest and close her eyes, listen to music, and just kind of relax in between contractions. Another low intervention pushing position would be sideline. This works really well for moms who may be exhausted and tired and who need a little bit of a break as well. But it also gives them freedom of movement while they're laying in the bed. For sideline pushing, a lot of times they can use some assistance from us, or a lot of times they'll pull their thigh up here and possibly this way. What this does is open up mom's pelvis, allows her to push. So ladies, this is another pushing position. This is great because gravity is helping her with the pushing, and it can save her some of her pushing efforts. Ladies who push in this position usually can have some rapid progress. During this time, she can relax in between contractions. I can put counter back pressure and do the double hip squeeze as well while we're waiting for the next contraction. And then when it's time to push, Lindsay can kind of bear down in the bed and push. And this works just great because she's in that upright position where gravity is helping her. The squat bar is another option for pushing. This is wonderful at using in kind of an upright gravity position to help with pushing. During this time too, the nurse a lot of times will help support mom's perineum, especially if the baby's getting close to delivery, because there can be a lot of pressure on our perineum during that time. It helps mom learn how to focus where to push because it helps with that pressure feeling. Do you mind to demonstrate, Lindsay? So during a contraction, Lindsay's gonna come up and she's gonna push and squat, and then when her contraction's over, she's going to sit back down and relax. Now, of course, if she was getting close to delivery, she might stay in this position or she might go to her side after that, but it allows mom to rest in between. But really helps give support for using gravity and upright positioning for pushing.
We can also utilize the mirror during.
Of course. The mirror is wonderful for moms who would like to help see their progress. Sometimes if they can see their baby's head too, it gives them an idea of where to focus and where to push, but also gives them that positive feedback so they can see that their baby's getting ready to be born. So this is an option for all ladies who are in labor if they would like to utilize it.
Great.
We have some other little accommodations that we can offer you guys during your labor process. We just got these little diffusers that are awesome. We have lavender and peppermint oil that we can put in them, and then they light up, they make the room smell great, they can be a calming effect for you. Some women like to put the oils on a wet rag and put it over their belly. That can help them soothe during contractions. This is the tennis ball that Courtney was kind of explaining to us, that we can put pressure on the back there, along with this little guy. And then we have K-pads that can warm up, and so we can obviously put that on your back where you may be having back contractions. That can just kind of relieve the pain in that way. And then
this is one of the belly bands that we offer. These are wonderful. This can help mom, if mom needs fetal monitoring, this can help hold the monitor in place with without some of the achiness of the straps. But it also is great because it can help hold heat or cold in place on mom's back to help as a comfort measure as well. So we call those the belly bands.
Awesome.
Yeah.
Courtney, thank you for your time. We appreciate all this information and look forward to seeing you later.
Thank you. It was my pleasure.